Are topical retinoids safe to use during breastfeeding? What can you try for postpartum hair thinning? Today, we're talking all about skin, body, and hair care for postpartum moms. What you can use and what ingredients you should be avoiding. Hi, my name is Dr. Jenny Liu. I'm a board-certified dermatologist and a mom of two, and currently with a 6-month-old at home. So whether you're a new mom or have kids at home and want to learn about how to care for your skin as a busy mom, you've come to the right place. I would love it if you can give this video a thumbs up and consider subscribing to my channel. So the postpartum journey for everyone is different, but just remember the hormonal changes that our body and skin, hair went through during pregnancy can still continue, including flaring or new onset of acne, eczema, hair thinning, as well as melasma. Certainly, everyone's experience is different, but the one good thing about postpartum compared to pregnancy is that we are able to be more liberal with treating our skin, taking care of our skin, using ingredients that otherwise should be avoided during pregnancy. And for me personally, what I've experienced during pregnancy and postpartum has been very different this time around. And each pregnancy is also different. My acne kind of have flared postpartum. It was okay during pregnancy. It wasn't great, but certainly didn't get significantly worse as I normally struggle with hormonal acne to begin with. But what I have noticed this time around postpartum is that my skin was ultra sensitive, struggled a lot with burning, dryness, itching, and flare-up of my eczema. And with my hair, I've actually struggled a ton with dandruff. And I normally don't get dandruff. My scalp is more greasy, which has actually led me to change up my hair care routine and washing my hair sometimes on a regular basis, where before I used to only wash it maybe at most 2 to 3 times a week. Now, as I alluded to earlier, we can be a lot more liberal with the things that we put on our skin, as well as oral medications and prescription treatments. Now, today I'm purely focusing on skincare products, cosmeceutical ingredients that you can find more readily over the counter. I'm not really going to talk too much about prescription treatments, although if you are interested, please let me know in the comments below and I'd be happy to make a separate video on that. Now, when it comes to skincare ingredients, actives, the only thing you really should be avoiding is hydroquinone, which is also one of the ingredients that you should be avoiding during pregnancy. Now, reasons why hydroquinone should not be used during lactation is that it has a pretty high absorption past the skin into the body, what we call systemic absorption, anywhere between 35 to 40%, and certainly have been found to be excreted into breast milk. Although we haven't really seen any harm of hydroquinone when it's in breast milk, and this is mostly from animal studies, we really don't have a lot on humans. But because of the high absorption and the fact that they are found in breast milk, it's recommended that hydroquinone should not be used at all. Aside from hydroquinone, really you can pretty much resume everything with a little caveat. So if you have been putting your topical retinoids on hold, as you should during pregnancy, it is 100% safe to restart it during lactation. Reasons being, number 1, vitamin A is also found in breast milk. 2, assuming you're using a topical retinoid to limited areas of your body. So most commonly, we use it on the face, maybe neck, chest, back of hands, at most for concerns of anti-aging. The amount used is very small and unlikely to get into breast milk. And this, I'm referring to retinoids of all sorts, including tretinoin, as well as over-the-counter cosmeceutical retinols and retinaldehydes. Tazarotene or prescription Tazorac has a slightly higher absorption into the body and potentially higher risk of getting into breast milk. But again, if it's used in limited quantities, again, mostly on the face for treatment of acne or fine lines and wrinkles, it's most likely to be safe. So, our American Academy of Dermatology have actually published studies and guidelines stating that topical retinoids is most likely going to be safe to use. So that is one thing you can absolutely restart if you are interested in continuing your topical retinoids during lactation. Now, the one thing I just want to mention, because this has happened to me, is that postpartum, your skin can certainly change and be more sensitive, like mine is. So that can also be from, stress, lack of sleep, environmental triggers or changes. So if you have more sensitive skin postpartum, you may want to be careful which topical retinoid you choose and use. So even if in the past you were able to tolerate higher strength prescription tretinoin, if this time around after restarting you're noticing really problems and a lot of irritation, you may want to consider stepping down to a over-the-counter retinol. So just be mindful when you are reintroducing that topical topical retinoid, go slow and make sure to find a formulation that addresses your concerns, that also allows you to use it on a more regular basis. And this is also pretty obvious, I'm sure you guys are aware, but just be mindful of where you apply your active. And that's true for tretinoin, salicylic acid, glycolic acid. You certainly don't want to apply on skin where you have direct skin-to-skin contact with your baby. That may cause irritation on your baby's skin, or say in a location like around the nipple where your baby may ingest that product. Another question that I always get is salicylic acid safe to use? And yes, in limited quantities. Salicylic acid in limited quantities is safe to use during pregnancy, so certainly you can continue to use during lactation. What you don't want to do is be using salicylic acid in the form of like a moisturizer where you're applying it on a regular basis to large amounts of surface area on your body. So that is a potential higher risk of absorption, especially if your skin is inflamed but compromised. And so this is more in the setting of when we treat psoriasis and we prescribe prescription salicylic acid medications. But if you have spot acne treatments, facial moisturizer with low concentration of salicylic acid, most likely it's going to be fine. And certainly if you have concerns, speak with your dermatologist. Another thing just to be mindful of is salicylic acid in peels. With the home peel kits that you can find over the counter, concentrations are often very low, and especially if you're doing a peel a few times a month or once a week at most, it's most likely fine. What you want to be avoiding is higher concentration, so more professional concentrations like in the orders of 20 to 30% done by your medical provider or say an esthetician. That you certainly want to avoid because of the higher concentration. There is a potential higher risk of absorption. Otherwise, salicylic acid, aside from it being in a moisturizer that you would use on a daily basis all over your body, ones that are limited to like the face or say spot treatment or chemical exfoliants that you use once a week is most likely going to be just fine. And I know there is a lot of confusing information out there. One of the most commonly asked questions I get anytime I talk about pregnancy or like lactation skincare is, are retinoids, can I restart my retinoids? When can I do so? And the answer is yes, you can absolutely restart your topical retinoids. Salicylic acid is also fine because we're under the assumption that you are using these in limited quantities as you normally do with these products anyway. Like I said, the only product or ingredient you really should be avoiding is hydroquinone. And along the same line, ingredients that you were able to use during pregnancy, you can definitely continue postpartum. So ingredients like alpha hydroxy acid is totally safe, niacinamide, hyaluronic acid, azelaic acid, kojic acid, tranexamic acid, vitamin C, all of those, peptides, those were fine to use during pregnancy, and so definitely okay to continue postpartum as well. I also get a lot of questions asking about self-tanners. So self-tanners, how they work is that it contains an active ingredient called dihydroxyacetone that basically interacts with the top layer of your skin, the dead cells in the top layer of the skin, and creates that reaction that leads to that tanning color. And because they are only localized to the top layer of the skin, they don't get past the top layer of the skin. It is absolutely fine to use during postpartum, when you're lactating, when you're breastfeeding, as well as during pregnancy. Now, what about hair care? Well, for the most part, because common things like shampoos and conditioners, they have very short contact with our skin, it's unlikely that anything will get absorbed past the skin. So if you are struggling with dandruff like myself, go ahead and either get a anti-dandruff shampoo or restart whatever you were using previously before. What you can find over the counter are most likely going to be fine and safe. There are scalp serums out there, and there's a lot with different formulations, kind of sticking to the rule that we said before, avoiding hydroquinone and limiting salicylic acid. So if you have dandruff and you're using a salicylic acid based anti-dandruff serum for your scalp, you probably just want to be mindful of what other salicylic acid products you are putting on your skin. So you certainly don't want to be using a scalp serum every single day, but then also using maybe salicylic acid moisturizer in large quantities to your face and neck. So it's more just the dose is the toxin. So just be mindful of the amount overall of the beta hydroxy acid that you would be using, whether it's to your face or to your scalp. When it comes to postpartum hair thinning, minoxidil can be an appropriate option. You guys have heard me talk about minoxidil before. It's one of the most effective treatments to grow hair without a prescription. And certainly the American Academy of Pediatrics recognizes topical minoxidil to be compatible with lactation. The only caveat is if you do have a premature infant and you're nursing a premature infant, there can be situations procedures where there may be higher risk in causing issues. So this is where if you are interested in starting minoxidil, the best thing to do is to speak with your provider just to check in. But most likely for the average mom who have a healthy infant, it's probably going to be just fine. One last thing I just want to briefly mention, because I get asked all the time on my social media, is are cosmetic procedures safe? And if so, which ones? Well, first and foremost, cosmetic procedures is such a personal thing. The best thing you can do if you're interested and you're currently nursing is to find an experienced provider that you're comfortable with, whom you trust, to have an open discussion to figure out what is going to be best for you to tackle your concerns, and also discuss the risk and benefits. To be honest, we don't have a lot of data on safety of these procedures during lactation, and the ones that are available are very small. It comes from small studies and also just our understanding of how these treatments work, and based on those theory, what we think is safe and unsafe. So what we do know are really not recommended are major fat transfer procedures or sclerotherapy. So liposuction, fat transfer, removing, stripping veins. What we do know from like the common things that are done, like Botox fillers, light and laser, they're most likely going to be fine for the following reasons. Number one, for Botox, how Botox works is we're injecting the botulinum toxin locally into your muscle. And so because we're using small amounts and they're supposed to be localized, otherwise they wouldn't work, right? So in theory, it should not travel into your blood to get into your breast milk to affect breast milk. Now, full disclosure, I have gotten Botox postpartum while I'm nursing. I certainly have gotten it this time around, and it's starting to wear off a bit. And that was one risk I understood and was willing to take, and my baby is fine. But this is where everybody have their own choice and doing what they're comfortable doing. And that was something that I wanted to continue. That's Botox. Fillers is a little bit more involved, and there's higher risk overall with fillers. Again, theoretically, purely the hyaluronic acid fillers I'm referring to, because they mimic our body's natural composition of hyaluronic acid. And again, because they're injected locally and to have a local effect. And that's the whole idea of doing these fillers. In theory, it should be safe. But there are other complications of fillers like infection, occlusion of an artery that may lead to ulceration, that may require additional treatment that just will complicate things. So at the end of the day, finding an experienced provider is really key. Now, lastly, I would say chemical peels are most likely safe. Again, avoid higher concentrations of salicylic acid and TCA peels, so trichloric acetic acid peels. And light and laser therapy for the most part is going to be safe because, again, we're using light and laser to target certain components within the skin, and these don't really get into your body because it's just using energy and tackling the concern. So certainly, absolutely, light and laser is going to be safe. So I hope you found this video to be informative and helpful, especially if you are a mom postpartum and wondering what you can do for your skin, for your body, and for your hair. Again, let me know if you have any questions in the comments below, and let me know if you have other topics that you want me to tackle. Thank you so much for watching, and I'll see you guys next time. Bye.